Good day, everyone. Today we'll be discussing one of the most critical areas in caring for neurologic patients, common screening tools and procedures in neurological assessment. These tools guide us in early detection, accurate diagnosis, and proper management. Let's start with the Glasgow Coma Scale or GCS. This tool helps us assess a patient's level of consciousness. It has three components: eye-opening, verbal response, and motor response. The total score ranges from 3 to 15. A score of 15 indicates full alertness, while a score below 8 is often a sign of coma. As nurses, we use GCS to monitor neurologic status regularly. A drop of 2 or more points is clinically significant and should be reported immediately. This tool is critical for prioritizing care and detecting early deterioration. The Mini Mental State Examination is a quick, standardized test used to screen for cognitive impairment, commonly in dementia or Alzheimer's disease. It evaluates orientation to time and place, registration and recall, attention and calculation, language and visual spatial ability. A score of 24 to 30 is considered normal. Scores between 18 and 23 indicate mild cognitive impairment, while 0 to 17 suggests severe impairment. The MMSE is particularly useful in geriatrics and for monitoring progression of cognitive disorders. As nurses, we can assist in administering this and identifying early cognitive decline. Next, the NIH Stroke Scale quantifies the severity of stroke-related deficits. It assesses several neurologic domains: consciousness, vision, facial muscle control, limb movement, coordination, sensation, language, speech, and neglect. Scoring ranges from 0 to 42. 0 indicates no symptoms, 1 to 4 is minor stroke, 5 to 15 is moderate. Above 20 indicates severe stroke. Nurses often perform this scale during admission, post-thrombolysis, and at regular intervals. It's essential in determining treatment, like eligibility for TPA, and in documenting changes in neurologic function. The CT scan is the first-line imaging test in acute neurologic emergencies such as stroke, trauma, or hemorrhage. It quickly visualizes brain structures and identifies issues like bleeding, tumors, or fractures. Contrast-enhanced CT can help evaluate tumors or vascular abnormalities. As nurses, we need to assess the client for allergy to iodine or contrast, ensure the patient is NPO if contrast is used, and monitor renal function before and after the scan to avoid contrast-induced nephropathy. The MRI provides more detailed images than CT, especially for detecting tumors, multiple sclerosis lesions, or spinal cord abnormalities. It can be T1 weighted, which shows anatomical detail, or T2 weighted, which shows edema or fluid. Before the procedure, we must screen patients for metallic implants like pacemakers or aneurysm clips. Patients may feel claustrophobic, so sedation or reassurance may be needed. Education about the noise and time involved is essential to gain their cooperation. The EEG records the brain's electrical activity through scalp electrodes. It's primarily used to diagnose seizure disorders, brain death, and sleep disorders. Nurses prepare the patient by ensuring a clean, oil-free scalp. We may need to withhold sedatives or anticonvulsants before the test to ensure accurate readings. During the procedure, the patient may be exposed to flashing lights or asked to hyperventilate, which can provoke seizure activity. We must ensure patient safety and monitoring throughout the test. Next, a lumbar puncture is performed to analyze cerebrospinal fluid, CSF. It's used in cases of meningitis, subarachnoid hemorrhage, or multiple sclerosis. Nurses play a critical role. Assist with positioning, either side lying or seated, bending forward. Obtain informed consent. Monitor for post-procedure complications like headache or CSF leakage. Encourage oral fluids and flat positioning afterward to prevent spinal headache. Watch for signs of herniation in clients with suspected increased ICP. LP is contraindicated in those cases. Nerve conduction studies and electromyography, EMG, assess peripheral nerve and muscle function. These tests are used to diagnose conditions like ALS, carpal tunnel syndrome, or myasthenia gravis. Patients may experience minor discomfort from electrical impulses or needle insertion. As nurses, we ensure they understand the procedure, and that no lotions or oils are present on the skin. These tests are vital in differentiating between muscular and nerve pathologies. Now let's test your understanding of the screening tools we've discussed so far. I'll be presenting 5 multiple-choice questions covering the Glasgow Coma Scale, MMSE, NIH Stroke Scale, CT scan, and nerve conduction studies. After each question, we'll reveal the correct answer and explain the rationale. Question 1. A nurse is using the Glasgow Coma Scale to assess a patient with a head injury. The patient opens their eyes to pain, utters inappropriate words, and withdraws from painful stimuli. What is the GCS score? A 10, B 8, C 9, D 7. The correct answer is C. Eye-opening to pain scores 2, verbal response with inappropriate words scores 3, and motor response of withdrawal scores 4. That gives us a total of 9, which reflects moderate neurologic impairment. Next question 2. Which of the following MMSE scores indicates moderate cognitive impairment? A 29, B 25, C 20, D 15. Correct answer, C 20. A score between 18 and 23 typically suggests mild to moderate impairment. A score of 20 falls within this range and would require further cognitive evaluation. Next question number 3. A client with an acute ischemic stroke has an NIHSS score of 6. How should the nurse interpret this score? A. Minor stroke. B. Moderate stroke. C. Moderate to severe stroke. D. Severe stroke. The correct answer is B. Moderate stroke. An NIHSS score from 5 to 15 indicates a moderate stroke. This scale helps guide decisions for treatment, including thrombolytic therapy. Next question number 4. Which nursing action is most important before a CT scan with contrast? A. Administer sedatives. B. Provide high-protein diet. C. Check for iodine allergy. D. Withhold fluids for 24 hours. Correct answer is letter C. Check for iodine allergy. Because contrast dye is iodine-based, it's essential to assess for allergies to iodine or shellfish before the scan to prevent allergic reactions. Last question. A patient is scheduled for a nerve conduction study. Which instruction is appropriate? A. Avoid caffeine. B. You will be under anesthesia. C. Do not apply lotion or creams. D. Wear loose clothing for heart monitoring. The correct answer is letter C. Do not apply lotion or creams. Lotion interferes with electrode conduction. The procedure is non-invasive and does not require anesthesia or caffeine restriction. That's the end of our quick guide on neurological screening tools. Remember, early assessment saves lives. Know your tools, trust your training. Thanks for watching.